Again, welcome to our webinar on the graduate nursing programs. Some of our objectives for our webinar today are to discuss the various graduate nursing programs we offer at the College of St. Benedict and review what those curriculum tracks look like for each program. We'll also discuss the eligibility requirements and application requirements and deadlines. In addition to that, we'll also speak to the clinical requirements for the different program tracks and then ultimately what the costs of tuition and fees are for the different programs. Our DNP programs are accredited through CCNE, and our MSN program received pre-accreditation status in February of 2024 through the CNEA. So the different programs that we offer here at the College of St. Benedict include two different Doctor of Nursing practice tracks. We have a Family Nurse Practitioner track, and then we also have a Doctor of Nursing practice with a focus in leadership. That program is offered in a Bachelor to DNP style, and then also in a postmaster's option. And then we have a Master of Science in Nursing, Leadership and Education for Practice that really focuses on that leadership and education piece of nursing. So the first track that we'll talk about is the Doctor of Nursing Practice Family Nurse Practitioner track. And I'm going to go ahead and click on this link, which will bring you to the website and the web page that talks more about this program. So this is all on our website, everything that we reviewed today. So if you have questions or want to refer back to things after today, then all this information will be on the website as well. So the Doctor of Nursing Practice Family Nurse Practitioner track is for those students that are registered nurses that are wanting to go on to that advanced level of nursing practice. Students after graduation will be eligible to sit for the certification exam as a family nurse practitioner, and then upon passing that will be eligible for licensure as a family nurse practitioner. Eligibility for this program is you must have a 4-year nursing degree completed from an accredited program prior to starting, a minimum GPA of at least a 3.0 in that program, a current unencumbered license as a registered nurse, and then we do prefer 2 years of work experience as an RN, but that is a preferred requirement, not a required. Tuition and fees, we currently have tuition at $950 per credit, and then there are some associated program fees with the program. And then in regards to financial aid, there are financial aid packages that students can be eligible for. So there is information about whom to contact in regards to questions regarding financial aid. So we'll go ahead and we will take a look at what the curriculum requirements look like for this program. So this is a full-time 3-year program that runs over 9 consecutive semesters. So we do run through the summer. Students can start in the fall or spring of that year 1. We do have a spring entering option as well. And when we look at this program, we start out in the first year of the program with what we call our DNP core courses. So these are the classes that are required for that doctoral level component. It's a lot of theory, research, and didactics. So in looking at the courses, you have research methods, informatics, theoretical basis for program evaluation. You have courses in epidemiology, ethics, organizational leadership and management. And then as we get into that summer, you have a course that helps you learn about that transition into the new role as an APRN. And then you have your evaluation and translation of evidence course. And in this course, students really start to explore that topic of their DNP project that they will be completing starting in year 2. As we get into the second year of the program, this is where we get into more of the program-specific courses. So you have your advanced pathophysiology, advanced pharmacology 1 and 2 this year, and then your advanced health assessment course where you're learning those advanced health assessment skills that you are required to know as an advanced practice nurse. And then you also will be starting your doctoral level project during this year. So in the spring of year 2 is when you have your first doctoral project course, and you will have this course consecutively now through graduation, and you'll be working on different components of your project in these courses each semester. So you'll have specific goals and deadlines that you'll have to meet to keep you marching along with the progress of your project. hopefully at this point, students have a pretty robust idea for their projects after they've worked in that translational class in the summer before this year. When we get into spring and summer, you also have an advanced diagnostics course. These courses are designed to teach some of those advanced procedural skills that are required of nurse practitioners. That would include things from suturing to reading imaging and x-rays, punch biopsies, joint injections, things of that nature. So that is what you will receive in the advanced diagnostic courses. As we get into the summer of year 2, this is when the first rotation of clinical practicums starts. So clinical practicums as a nurse practitioner, you are in the clinic with a preceptor seeing patients, and you build on those skills each semester. So the rotations start in the summer of year 2, and then you will have rotations each semester until graduation. The focus of this first summer rotation is really in that family practice realm where you see across the lifespan and start to get that comfort in seeing patients, talking to patients, getting a good history and physical, and making some recommendations to your preceptor about diagnostics that you would order, how you would evaluate those diagnostics to come up with your differentials and your diagnosis, and then ultimately what your recommended treatment plan would be. So I tell students to anticipate being in the clinic approximately 2 to 3 days a week with your preceptor seeing patients. So, anywhere from 16 to 18 hours a week in that clinic setting. And then you're continuing to work on that doctoral project this semester. And then as we get into the fall, you'll continue with your clinical practicums. You have your second didactic course or theory course that's teaching about the things that you will see in the clinic as a nurse practitioner, anything from, women's health, which is the focus in the fall, to various things we manage in family practice, acute type scenarios, and that whole well primary care piece. So how to do well exams, annual exams, primary care prevention, well child exams, and things of that nature. In the spring of year 2, again, you're continuing progression on your doctoral project. You have your third theory course, which this one has a continued focus on family practice, but we also pull in the urgent care piece and then pediatrics. And then in your clinical practicum, again, you'll be continuing to work in a family practice setting, and then you'll have some hours in a pediatric setting as well. And then in the summer of the final year, you will have 2 different theory courses. One will focus around specialty care management. So it's additional training and education on some of those specialty care areas that we do see as nurse practitioners. So talking a little bit more about those older adult populations, the pediatric populations, the urgent care, emergency room type settings, mental health, endocrinology, things of that nature. All the things that we do see in that scope of practice as a family nurse practitioner, but we just need to provide a little bit more education on. And then you also have what's called your capstone course, which this course is really meant to prepare you for moving into that next role as a family nurse practitioner. So we have recruiters that come in and meet with students. We do mock interviews, get your resumes all prepared. We have speakers that come in and talk about the legalities and ethics of working as a nurse practitioner, talking about anything from malpractice insurance to adequate documentation, thinking of it from that legal perspective. We have other experts, in the field of kind of starting that role transition into that new piece. Come in and just talk about how to be best prepared for moving into that next role. And then you also do preparation for your certification exam. So we have embedded a review course within your capstone to help prepare you to be certified as a nurse practitioner after graduation. In the semester 2, you will be finalizing your doctoral project and writing your final paper. You will disseminate your findings to both the site where you complete your project and also to your faculty. And then you will do your final defense of your project. After passing your defense, then that's sort of the final step to gaining your doctoral degree. We also have what we call a symposium research night for our students that are graduating this semester to have an opportunity to showcase your research, to family and friends and also to your peers. So after those 5 semesters of hard work working on this project, we want to give everyone the opportunity to show all the hard work that they've completed. So this program, like I said, is 3 years full-time across 9 consecutive semesters. The total credit hours are 70. And I've often been asked, you know, is there a part-time option? And that is a possibility. And I would say if that is something that's interesting to you, to reach out to me and I can show you what that could look like for you. When it comes to working, that first year where you have your DNP specific courses, there's a little bit more flexibility. So maintaining your work status for most people, I would say, isn't challenging. We do have a hybrid program. Most of what's taught in that first year is between synchronous and asynchronous online with a couple of in-person class times each semester. But then as we get into year 2 and 3, that is where you're learning those hands-on components, and then you're in the clinic setting with your preceptor. So we recommend that students entering into year 2 don't work more than a 0.6. If you can work less than that, it makes it even easier to try to schedule in your clinical hours. But we also will be having longer days on campus. So students should anticipate once they get into that spring of year 2 with the advanced health assessment and advanced diagnostics, that you'll be on campus for full 8-hour days, approximately once a month. And that will continue then through graduation. And again, that is for that hands-on component that is required of our nurse practitioners. So that is our family nurse practitioner track. And now we'll move on to talk about our DNP and leadership track. And again, I'm going to go ahead and pull up the website for this program that has all the information that I'm talking about on the website. So again, this program track is really meant for those people that are wanting to gain additional experience and skills in the realm of leadership. So that could be for current nurse practitioners who have a master's level degree and are wanting to go on to get that DNP and want to seek out some additional leadership skills, or for those students that have graduated with their bachelor and are really wanting to advance their degree, see themselves maybe working in education or administration, or wanting to get that doctoral level leadership degree. Both of those people would be great examples of, you know, people that this would be a good option for. So I'm going to pull up what the postmaster's entry looks like for these students. So again, for this program track, it is full-time across 6 semesters, and you'll find that there is a lot of overlap with the courses that our family nurse practitioners take. So that first year, again, it's those DNP core essentials like informatics and epidemiology, healthcare systems, all the same as what our nurse practitioner students are taking. And that we find is valuable for our students because students have different experiences in their clinical environments and in their precepted clinical experiences, and it can bring a very robust conversation to the classroom, whether in the online world or in person. So it's nice to have that variety of students in the classes. You'll see in the postmaster's option, you start into that doctoral project right away in year 1 in the spring. So you're moving along with the nurse practitioner students, but it's earlier in the program for this postmaster's option. When we get into the summer, this is where you start getting into your track specific courses. So you have your first leadership course called the Influential Nurse Leader. This course really focuses around those individual leadership skills and how to maximize those. And then you have your first practicum as well. Now, these clinical experiences are going to look a little bit different than our nurse practitioner students. These aren't hands-on patient care types of experiences. These are experiences to really help you gain knowledge to be an effective leader. So these are 1 to 2 credits, and that will depend on, for people that are coming in with a master's degree, how many clinical hours they had in their master's program will depend on how many hours they will then need to obtain their doctoral degree. So a DNP requires a total of 1,000 hours. So how many hours each student completes will look a little bit different from student to student. But that first rotation will be completed in the summer. Examples of the kinds of experiences that our students will have. We've had students work with presidents of hospitals, administrators within a hospital setting, directors of advanced nurse practitioners, administrators in clinic settings. We've had students who have a strong interest into going into education, work with faculty in higher education to learn more about that role. So we really try to tailor it around the individual goals for the student. We have some really great relationships in central Minnesota because of our long-standing nursing program in the area. And that has really made for some great opportunities for our students in regards to this leadership rotation in particular. So we're really excited about the kind of opportunities that our students have had in these rotations. So then as we look into year two, in the fall, you have your second leadership course looking at creating a vision for nursing practice. So this is looking more at that organizational level of leadership. The second clinical rotation is here, and then you continue on with your doctoral project. In the spring, you have your ethics course that you will be taking in combination with the nurse practitioner students. That third clinical practicum, and then continued progression on your doctoral project. And then that final summer, you have your final leadership course. And that course is called Modern Decision Making in a Collaborative Environment. And this is really looking at that more global perspective of leadership. So we've looked at that individual level. Now we've looked at more of that systems level, and now we're getting that global perspective. So an example of student work that was done in this course, we've had students create business plans for developing a new clinic or organizational type endeavors. So again, our strong relationships with alumni and just area healthcare organizations have really lended itself to some very unique and educational opportunities for students. And then again, in this semester, you'll be finishing that doctoral project and doing your final defense, and then having the opportunity to disseminate your findings. So that is our DNP and leadership. The tuition and fees are the same for this program track as they are for the family nurse practitioner track. And then now we'll talk about our final program, and that is the Master of Science in Nursing, Leadership and Education for Practice. So this is a master's program that is meant for people that are wanting to take that next step in leadership or possibly in education. So you're somebody that maybe wants to work as a nurse educator on your unit. Maybe you see yourself working in higher education, teaching nurses. Maybe you're wanting to work at more of a director level or an administrative level within an organization. All of those people would be good fit for this program track. Upon completion of this program, students are eligible to take the CNEL certification exam for certified nurse educators. So that is something that is a great opportunity, whether you're looking to stay within an organization or whether you're looking to possibly teach in higher education. Again, the eligibility requirements are very similar to the doctoral projects. A 4-year nursing degree is required from an accredited program. You must have a GPA of at least a 3.0 in that program, and then a current unencumbered license as a registered nurse. Tuition and fees are slightly less with the master's program. So credit hours are $800 per credit hour for the MSN, and then similar program fees are associated with this program as well. And then one thing I just want to point out that's more applicable to our undergraduate nursing students is we do have something called a 4+1 option. And this is a unique experience that we offer to our current St. Ben's and St. John's undergraduate students that allows them to apply and be accepted to take graduate level courses their senior year of college. So those courses will apply towards some of their educational requirements for the nursing program. So it eliminates some other courses that they would take. But they also then can apply these courses to continuing on in the graduate program. So if they continue on into the master's program after graduation, they will only have a year left to fully obtain their master's program. So it shortens the amount of time that it takes to complete that degree. And then it also is a little bit less expensive because they get charged the undergraduate tuition rate when they take those courses as an undergraduate student. So I just like to point that out. Again, more applicable to our undergraduate students, but kind of a unique option. So our MSN program is 6 semesters simultaneously across 2 years. And again, you're going to see some common themes here with some of the courses. So with our core courses, there is crossover between our doctoral and our master's level courses. So in this first year, there'll be a lot of opportunity to have classes with the doctoral level students, especially in semester 1 and 2. As you get into the summer, you do take that influential nurse leader course along with our DNP and leadership students. And then as we get into year 2, you will also be required to take the advanced pathophysiology, the first advanced pharmacology course, and then the advanced health assessment course as well. So with master's programs, all programs are required to have what we call the 3 Ps, which are those 3 courses. That is also considered core of a Master of Science in Nursing course. In the fall, you'll have your first practicum course. And this practicum is working with a preceptor. And this is really to help make you that expert clinician at the RN level. So really finding experiences that are going to build on your experience as an RN to really make you that expert as an RN. As we get into the spring practicum, that is going to be education focused. So learning how to engage a learner, how to facilitate learning in different environments, whether that be in an organizational setting like a hospital or a clinic, or in an academic higher learning setting, how to write curriculum, how to assess student learning, things of that nature. As we get into that final summer, you do your final practicum course. In this, we focus more on that leadership component. And in that practicum, in that leadership focus, we're helping to kind of fine tune some of those higher level leadership skills. You have your transitional class where you will have a capstone project that is due. So if you think about kind of that idea of a thesis, this is where that would be. And then you have another course called Advanced Clinical Knowledge. Again, just trying to build on your knowledge as an RN with a graduate level degree. As I said before, students are eligible for the CNL, Certified Nurse Leader, and the CNE-CL certifications upon graduation. So what makes St. Ben's unique in regards to our graduate program? So there are a lot of different programs out there. There's a lot of really great programs out there. One thing that makes us unique, I think, is that, especially for our nurse practitioner students, but this applies to all students, is that we do guarantee clinical placements. As somebody who is a family nurse practitioner who had to find her own clinical placements back when I was in school, that can be challenging. You have to do a lot of networking. You need to definitely have connections, and those can be difficult placements to secure. So we take that burden off of students. We have a lot of great partnerships with a lot of different organizations, and that provides us opportunities then for our students. So we do guarantee clinical placements, and that is for the master's and also the leadership in DNP as well. We do one-to-one mentoring for our MSN and DNP projects. So each student is assigned an advisor that oversees that progression through the project. We do have part-time options available. So if that's something that you are interested in, I would encourage you to reach out to me. We can set up a time and go through what a part-time option would look like and the different variables that go with that. And as I've talked about, we do have that opportunity for some very unique collaborative partnerships between our alumni and just our area healthcare organizations that we have strong relationships with. It's provided some very unique and robust experiences for our students. Our program is a hybrid program, so you will have a combination of in-person and virtual learning. And how often you're on campus will definitely depend on the program track you're pursuing and then also the courses that you're taking. But especially with that master's and the DNP and leadership, there's a lot of flexibility with that hybrid component in regards to what a schedule could look like. But I tell students to anticipate being on campus approximately 2 times a semester. For those nurse practitioner students, as they get into those hands-on courses, to anticipate approximately once a month. So So that is it on our graduate nursing programs. If you have any questions, please feel free to ask them. Otherwise, you can reach out to me later if you have other questions that come up.
Thanks so much, Jennifer. I've been monitoring the Q&A in the chat, and I don't see any questions, and I know you were able to address the questions that came in on the registration sheet, so I appreciate that. One series of questions that we have had over the past few weeks, and that I think was in one of the registrations, was regarding capacity for international students. And I just want to let people know at this time, our graduate nursing program has not been added to our CBSS certification. And so we are anticipating that possibility for fall of 2025. But at this time, we don't have the ability to provide an F1 visa to a graduate nursing student. In addition, I do want to mention our July 1st application deadline for the fall 2024 semester. So if you go to the Nursing CAS website, as Jennifer has posted, that is our admission area for application. You will see all of our programs available in that deadline of July 1st for the fall semester. We would love to work with you and answer any questions you have as you pursue your graduate degree. And with that, Jennifer, thank you. I think we're done. I don't see any questions coming in. So thank you all. Thanks for doing this, Jennifer. And I'm sure we'll have more coming up in the summer months here.
Yes, thank you, Terry.
Have a great day.